A normal calving has 3 stages: the preparation, the expulsion of the calf, and the expulsion of the fetal membranes.
The smoother the birth, the better the calving. The more you take action at the right time, the closer you follow proper timelines and best practices, the more subsequent events will unfold harmoniously.
During the first stage, which is the preparation, the tissues that form the birth canal will relax. The cow's udder becomes enlarged. The ligaments on either side of the base of the tail will relax. Soap and water are used to clean the vulva prior to examining the cow. Use an appropriate lubricant to perform the exam. Some soaps can lubricate, but they can also dry out the vagina. Your veterinarian can recommend effective products that cost very little. However, if the calf is not there, you must try to locate the cervix. It is somewhat donut-shaped. If there is still no change, it could mean that the cow is not ready or that the cervix is not dilated. At that point, it might be wise to call a veterinarian to try and figure out what is going on. We then go to stage 2, the expulsion of the calf, which is fairly self-explanatory. You will see the amniotic sac or water bag begin to appear at the vulva, then the cow will begin to push and break the water bag. At this time, the cow will often lie down and push to deliver the calf. If you see that 2 hours have passed since the cow's water bag broke and the calving is not progressing, it might be wise to check again. The first thing to determine when you decide to take action if the calf has entered the birth canal is the position of the calf. You must have at least 3 elements, that is, either 2 feet in the head or 2 feet in the tail. At this moment, you can attach chains or rope to the feet. The placement of the chains or rope is very important. I would suggest that you create 2 loops, one above the fetlock and one below. That way, there is no danger of damaging or fracturing the calf's limbs. When using a calf puller, always synchronize your actions with those of the cow with the cow's contractions. There is no hurry. You have to work with the cow to assist her effectively and to prevent injuring her. On the other hand, with an anterior presentation, the head is coming and the chest begins to appear. Time becomes a factor because the umbilical cord is somewhat compressed, and you must speed things up to improve the calf's chances of survival. With a posterior presentation, you see the base of the tail appear and the umbilical cord is slightly compressed. You need to move things along to get the calf out as soon as possible and get it to start breathing. The process is not over yet. The placenta needs to be delivered as well. You have to monitor that. Also, if the cow is still having uterine contractions and the calf that was delivered is small, it is always a good idea to check for twins.
One of the most important adaptations the calf goes through is learning how to breathe. If that doesn't happen, it ends right there. To initiate breathing, the lungs have to expand correctly, and the best position for that to occur is placing the calf in a sternal position, that is on its belly. That allows both lungs to function. Now, if the calf is placed on its side, either on the left or right lateral decubitus position, the lung that is on the top will function better, but the lung that is underneath will have a harder time because of the weight pressing on it and the accumulation of fluid. The idea of hanging a calf by its hind legs is based on the belief that it can help to eliminate secretions and make breathing easier. The problem with that kind of position is that the internal organs, the intestines, everything will push down on the diaphragm. So gravity is forcing everything down on the diaphragm, just as the calf is trying to catch its first breath and needs its lungs to expand completely. In light of current knowledge on the subject, should you decide not to hang the calf by the legs and rather place it on its belly right from the start, that's probably the best way to go. Secretions can accumulate in the mouth. You can remove them with your finger or use a syringe to suction them out. Secretions can sometimes be more viscous, thicker. They might even slightly obstruct the upper respiratory tract. It's worth it to clear those secretions. Stimulate the calf by sticking some straw or a finger in the nostril, some cold water in the ears.
There is no contraindication to letting the dam lick her young after her birth. It's even beneficial to the calf because it will stimulate it and help it to dry quicker. For the cow, it can be seen as a reward. In the summer, the calf should be in a well-ventilated area, at least for the first day. And in winter, in a warmer area, because on the first day, the calf has yet to learn how to regulate its own temperature. You can bring some warm water to the cow, and ideally, the calf should be separated from the cow within 30 minutes. If you decide to disinfect the navel at birth, it's important to do it with an iodine solution at no more than 5% concentration. But in any event, it's important to place the calf in a clean and dry location. You can also skip navel disinfection and get good results. If you don't practice it and have a winning formula, there is no need to make any changes. At birth, the heifer calf has no antibodies of any kind. That's because the placenta has the ability to prevent antibodies from the mother of reaching the fetus in utero. However, antibodies are found in the mammary gland. Therefore, the best way to protect our heifer calf is to give it the first milk, which is the colostrum. There are three main things to remember about giving colostrum: quality, quantity, and timing. And the two most important ones are the quantity and the timing. That is about 4 liters of colostrum in the first 6 hours of life to give the calf the best possible head start.
The colostrum of a young cow may not be as rich as the colostrum of an older cow. You can compensate by giving more of it to the calf.
It is extremely important to use a proper milking technique and proper hygiene when collecting the colostrum for the calf.
Studies have shown that giving or not giving colostrum to a newborn calf will have an impact not only on the first few days of life, but on the first several months up to 2 years of age. There are long-lasting repercussions to electing to give or not to give the colostrum that the calf should get. To me, colostrum is the best kept secret.
When we see that the cow is ready to calve, we always go check. Is the calf positioned correctly? Is the cow dilated? Is there any sign of torsion? We always check those things.
Some interventions are more serious than others. Twisted uterus, things of that nature, physically. I'll do what I can, but at some point, it's a job for the veterinarian.
Our veterinarians are very good at showing us what to do, explaining things to us, teaching us how to manage on our own as much as possible. I think that's very good. Colostrum for the newborn calf, it's really at will. If it can drink a solid 3 liters, that's great because I really want it to build up its immunity. Colostrum is like a vaccine that is very easy to give at birth.